Hi, everyone. I'm Katherine Sanders from Sanders Consulting, and this conversation is part of my series of conversations about the Surgeon General's framework for workplace mental health and well-being. And today I'm delighted to be talking with a physician. This is Dr. Gregory Charlop, and I'm going to ask him to introduce himself, tell us a little bit about his expertise and his interest in well-being.
Well, thanks for having me on. It's great to be here, and this is such an important topic, so I'm delighted to join in. I'm the founder and author of the Physician Wellness Project. So I work with doctors and healthcare professionals who are looking to improve their careers by changing jobs or making their jobs more satisfying or more empowering or with a better work-life balance. And I work with healthcare organizations that are looking to attract and retain better employees because, frankly, with physician burnout and nurse burnout being what it is, it's very difficult these days to attract and retain good people because it's unfortunately a lot of workplaces aren't offering what people are looking for, so it's hard to find a match. So that's what I'm really focused on these days. But I'm also a practicing physician. I'm an anesthesiologist, so I take care of patients that are getting surgery. And sort of coincidentally, I wrote a book before the Physician Wellness Project. I wrote Dr. Greg's Green Home Makeover, which also sort of dovetails with a lot of the work that you're doing about how to make homes and businesses more kind of ergonomic, but also more environmentally friendly and healthier. So I think we'll have a lot to talk about. I'm excited to be here for it.
Yeah, me too. I'm really glad I was able to find you, that we lucked into each other, because as you mentioned, I think there is a lot of overlap. I'm just going to start, Dr. Charlop, with the same place I start with everybody, which is by showing this framework from the Surgeon General and just asking you, when you look at this, what stands out for you and why?
Well, two areas that I really focus on in my work are from this framework are work-life harmony and mattering at work.
Mm.
And as someone who's been in the trenches, who's been in these situations where you're at work and either you can't seem to find a way of working where you give your all to work, but also you harmonize it with life. In other words, you have time for your spouse, you have time for your kids, you have time for health issues like going to the gym or playing sports, and you have time for your own projects. That's a big problem. But it's a problem that can be solved. But I also think it's a related issue is we see a lot of burnout from physicians, not only from the time issue, but also from the mattering issue.
Mm.
And what I mean by that is there's a lot of doctors, they're sacrificing seeing their spouses and their children and their activities and their pets. I've got a dog at home that I feel bad leaving behind whenever I'm at work. But you do it
Mhm.
because you think you're supporting a bigger goal. You think that you're improving health. You think that you're contributing to something big. But when you do that, and then your efforts get short-circuited by some bureaucrat upstairs, it's very disempowering, and it makes you wonder, well, why am I giving all these things up if, all of my efforts are just cut short by someone upstairs who's a paper pusher who isn't even taking care of patients?
Um, I I can really relate to the um, point you're making. I've done some work with physicians over the years, um, and I'm not sure if this is the case for you, but I am interested to hear your take on it. A lot of people that I've worked with have felt like a calling, like they want to be a healer. That's the point of going through all this trouble and expense to go to medical school, to go through your residency, to become a physician. And then the experience of work sometimes can be so dramatically different than the idea of what it was going to be like. Did you find that to be the case in your field?
Well, so you've hit on a great topic, it's sort of this idea of moral injury.
Mhm.
So you go into medicine, and I'm sure this is true for other fields as well. I'll just speak from my own experience, but you go into medicine because you're trying to help people and you kind of have your own ideas about how you want to do it. But then you're put into this situation where you can't help people the way you expected that you could, either because it goes against policy, you want to do things one way, but the policy is another, or there aren't enough resources.
Mhm.
And so you feel like you have to turn people away that you want to help, or because every effort you make gets stymied by some sort of bureaucratic hurdle. And so those things cause moral injury and they cause burnout. And, just as you said, you've sacrificed a lot to be able to do this from your personal life and other things you could have done. And then you can't actually act and take care of patients the way you like. And it causes a lot of internal turmoil.
And I think it also connects to the work-life harmony piece you were also highlighting. I, for a number of years, taught the physician leadership program for the Wisconsin Medical Society. And so obviously that brought together physician leaders from around the state to talk. But then when we would have events, I always wanted to have, and this is still a dream, have events with the spouses there,
Mm.
because the work that we ask of people can be very harmful to their family life. And so I'm just thinking about like shift work, being on call, outrageous workloads where people are working after they get home, right? Because you just can't finish during the day. And then what it does is it erodes your support system at home. And so you're stressed now at work and you're also stressed at home because the family is like, well, so dad's not coming to the party again, we gotta go, or we gotta go on vacation without him, or mom can't make it to my recital again, right? And so that kind of dynamic also is exhausting for people. So I really appreciate how these pieces that you've highlighted really are, this is a system, but they're really affect each other.
And you're right. And I'll just to add on that a little bit.
Please.
So you're correct that your day job, taking care of patients at the hospital, automatically typically takes a lot of time and it has weird hours, as you say. And so it does cause you to not see your spouse or kids as much as you would like.
Mhm.
But there's also a tremendous amount of unpredictability. In other words, I could think that I'm going to be finished in the operating room, say at 4 o'clock. And so I may want to make dinner plans, say with my spouse or with my kids or something at 5:30, thinking, well, I should be home by then. But the problem is you're not always home by then. And if the surgery runs late or there's an emergency or something, you could be there till 8 o'clock.
Mhm.
So that causes you to do one of two things, both of which are bad. It causes you either to never schedule anything because you don't know if you'll be there late, or it causes you to constantly cancel things that you've planned, where you have to say, yeah, I'm sorry, we were planning on having dinner, but I'm stuck at work late again. And those things take, obviously wear and tear on you, but as you say, they take wear and tear on your spouse and your kids too, because
Mhm.
you're either never planning anything with them or you're canceling on them all the time. And it's not like you could just leave some patient behind in surgery because you have a dinner plan at 5 o'clock. You just can't do it. And so
At least I
unless
hope you don't
there's
do it. If
a
I'm the patient, I hope you don't do it.
right, yeah, right. Yeah, I mean, you can't and no doctor would ever do that, right?
Mm.
No doctor would do it. So your first call, your first duty when you're with a patient is always to the patient. There's just no way of getting around it. There's no one I know, even the most burned out person would ever leave a patient in the middle of surgery, for example, because they have dinner plans. Like just no one would do that.
Mhm.
And so it does cause a lot of wear and tear on spouses.
Yeah. I mean, I've heard, even divorce rates are higher, and this is strangely also true with administrators in healthcare. And so I think the stress of these systems, the way we've currently designed them, is is not only harming the professionals that work within them, but also the family dynamics of those people. So I like the way you've linked those two things together. I
Well,
think
and
it's
it
very
is tough for the
important.
administrators because, and I'll be honest, so I worked at a hospital, major medical center for many years, and I left because I felt like I wanted more than I was able to get there in terms of more flexibility and the ability to pursue my own projects. But I always respected the administrators there, truthfully. Yeah, I didn't always agree with them, but I always felt they meant well. I felt they were working hard.
Mhm.
I felt like these were dedicated people, and I also felt like they wanted to help the patients. Maybe they didn't touch the patients like I did, but I felt like they wanted to help them. So they had to deal with all the flack from people like me who are going up saying, look, this isn't working, that isn't working. But then they have to balance it out with the people in pharmacy or the people who deal with the health insurance companies or the accountants who feel differently than I do about stuff.
Yeah. I mean, as far as I can tell, as an engineer who's been trying to help these systems, like the suffering is quite universal, right? I mean, it's like everybody's suffering, perhaps for some slightly different reasons, but it's like a system that isn't sustainable. And we're seeing that, as you mentioned in your opening comments, it's harder and harder for people to stay within these systems and be able to live a healthy life. And so you see people leaving, young talent like yourself, right? Like you left, made different choices, and that's a big loss. I mean, it's hard to replace people that know what's supposed to happen and are good at it. And so even if you had this big pool, it's still expensive to have this kind of turnover. So,
And one of the things I've noticed, when you talk about turnover and burnout, and there's certainly a lot of explanations for it. And if you want to talk about it, we certainly can. But COVID was certainly a big problem for everybody in healthcare.
mhm.
I think email, I hate to say it, is a big problem. Thankfully, not so much for anesthesia, but for a lot of other medical fields. You take care of patients, in the hospital. You were talking about taking work home with you.
Yeah.
You get home and now you have 500 emails to respond to that typically you aren't compensated for and isn't factored into your daily work. So you can't really, even if you were home in time for dinner, you still have to deal with all these emails hanging over you. There's a lot of things, but another thing that I think isn't discussed enough is a lot of people in healthcare today, like so when I was I appreciate you calling me young. I don't know if I feel that way anymore. But back in my day when I
You
was
get to be a
deciding,
certain age and everybody looks young. So,
yeah. So I'll take the compliment. But back when I was deciding whether to go to medical school or not, I liked a lot of different things. So I considered other options. But truthfully, the only other kind of real high-powered professions at the time that would have appealed to me would have been medicine, law, or some sort of finance/investment banking/consulting kind of thing. One of those three. So there were really like three options available to someone of my interests. But now, if I were today, if I were, say, in my third year of college, there's 1,000 things I would be interested in. Like I would love to be a startup founder or co-founder with a startup. I would really think about doing something with tech or inventing something. I would love to be a travel blogger. There's like a million
mhm.
things that would have been awesome to do today that were not on the table for me back then. So when you look at younger people, like if in myself, I think, well, I still only had a few options. I may be burnt out, but this is kind of what was there. But a younger person today would be thinking to themselves, I gave up starting a company for this. Like I gave up being some sort of international nomad where I could take my laptop and work in some cool cafe in Indonesia, but I gave that up for this. That's tough because now these people know what they're missing and they're missing like this whole world of opportunity. And
Mhm.
they gave this whole world of opportunity up to be working late, to be working unpredictable hours, and as you said, to have a high divorce rate. You wonder if that was worth it.
True. Very true. And so we've outlined a lot of the challenges in the current set of realities. Do you have um, things that you've done or that you help your people do that improves their well-being? I'm certain you do because, this is why I wanted to talk with you. But if you could tell us a little bit about what ideas or guidance you have for people, that would be fantastic. So,
Yeah, no, I'd love to. And one of the things that excites me about this is I do think there are solutions to many of these problems. The lack of healthcare providers is a hard one to solve. That one I don't have a good solution for, but everything else there are solutions for. And we talk about this a lot in the Physician Wellness Project, but one of them is a lot of people that go into medicine, they're creative people. I actually talk about this in the book. I call it the medical school paradox. So if you look at a lot of, say, doctors, they're not just people that had good grades. Good grades and a good MCAT score is not sufficient to get into medical school. You have to have done other things like played violin at like near professional level, or started a business, or started a charity, or volunteered to help disadvantaged kids in the inner city. Everybody who's gone to medical school has done those things, and we select for people that have these interests and these skills and abilities, which is good. I support that. But the problem is you're taking these people that have all these interests, and then you're putting them through medical school and residency and now into a job, and you're saying, well, you know what? You can't do any of those things anymore. You can't do them either because you don't have time, or because we don't allow it because we have these non-compete agreements. You can't go do medical services in the inner city because the only way you could use your medical license is with us. You can't start that startup on the side that has some medically related thing because, again, you're competing with us, even though you're not really. And so you're taking all these people with varied interests, but then you're snuffing those interests out.
hmm.
And I think that that's sort of soul crushing for a lot of people. So one thing that I recommend both to the physicians I work with, but also to the hospital administrators I work with that want to keep physicians, is let's find a way that we could maintain these outside interests, these desires to start a business or to play violin or to help people charitably. Let's maintain that while keeping your job. Let's find a way that we could integrate these things together, because you're a multifaceted person. And yes, you might like seeing patients in your clinic, but that's not the only thing you want to do. And if you want to be doing this for the next 50 years, if we're forcing you to only see, kids in clinic because you're a pediatrician, you're going to get burnt out because you want to do other stuff. So I think one option, which is actually easier than you think, as long as you're willing to do it, is give these doctors more opportunities to pursue creative outlets. And you could even do this within the organization. We talk about meaning at work. That was in the Surgeon General's report. Even something, you could see this in the business world, for example. Like if say you work, I don't know, for IBM or something, and you're an engineer and you have some engineering idea, you could leave IBM and start your own company for your own engineering idea. Or there's this sort of idea of a startup within a company. In other words, you stay with IBM,
Mhm.
but you're given some time and autonomy and a budget to pursue your idea. You're still working for IBM, but it feels like a startup under their umbrella. When you do stuff like that, that's exciting for a lot of people. It gives you a creative outlet. Google did that with their 20% time. Hospitals could do that. Why not let the doctors, if they're so inclined, have their startup within a startup in the hospital? They could start up their own program. They could start this or that. A lot of them would be happy to even work extra hours if they had some autonomy and some creative outlet within the hospital. So things like that are kind of easy, low-hanging fruit that both helps the hospital, helps the patient, and helps keep the doctors interested.
I like that you mentioned, pursuing other interests, and what it brought to mind for me is the hours that we're asking people to work, right? And how arbitrary they really are, right? Like the 40-hour work week was made up by, bargaining between unions and the government, nearly 100 years ago. And so the idea that every job to be full-time has to be 40 hours it's actually quite crazy. The demands on an anesthesiologist in the OR are different than the demands of a dermatologist seeing people in clinic, which is different than the demands of being a pediatric nurse, which is, you know what I mean? So like
Right.
from my perspective, each job, each profession should have an analysis of what the demands are and then how much recovery time people need from them. And I know some physicians who work for large healthcare systems who just want to go down to part-time so that they can have time for their families or time for these other interests that you're mentioning. And they're not allowed to even be part-time, which means taking less money, right? And working fewer hours. And that's not even allowed. So, I mean, this is a huge tension point that you're pointing to about what we're expecting of people, and over a career or even over a decade, what are people actually able to sustainably give? So I think
Right.
it's
You're
important.
totally right on the money about this. I think between fields, there's a difference. And even within fields, if I'll look at myself when I first started anesthesia versus myself today. When I first started, I didn't mind working a lot. I was single. I didn't have kids. I had a cat, but so I didn't mind working a lot because I made more money. It was exciting to me because I trained to do this all this time. So it was fun for me to deploy my training. It was cool to actually use the stuff I was learning.
Look at me, I'm an
And it
actual
made me,
doctor. I'm doing it.
yeah, I was an actual doctor. I got an ego boost out of it, because I was taking care of these sick, complex patients. I felt needed. I mean, it's weird to say this now, but I felt needed if I had to stay late or get called in because I'm like, wow, I'm not important that like I have to come in and, like, so, and then the time I was off, I really enjoyed it, So even if I worked, say, every other weekend or every third weekend, the weekends I wasn't working, I had enough money and enough energy at the time. I would travel or I would do something cool, so I was good with it. It worked. But then, I got older. I started to want to do other things. I had kids, and so what worked for me then doesn't work for me now. So if there were some way that hospitals or medical groups would make this process easier, where the younger Greg could get more work and more weekends and more money, but the older Greg maybe would have less of those things, but maybe would do some creative stuff or whatever. That would make everybody happy. You'd keep everybody engaged, and I think you'd have more output.
Yeah, I 100% agree. I try to explain what I do in work systems engineering as, if you imagine this like ergonomic chair, right? That's a few $100s. It's meant to fit a range of humans, and it's meant to do a range of motions. It doesn't fit every human and it doesn't do every motion. But if we could create work systems that responded to their own people, right? Work systems that fit a range of people. And then as those people change over time, the work system could actually be flexible enough to meet people's changing needs, right? So as you so eloquently pointed out, when you had just graduated, and were a full doctor, you had one set of priorities and a growth period where, I'm doing this. This was the dream. Here I am doing it. And then as your life changes, and if the job doesn't change too, then we've got some tensions, right, that we couldn't have seen coming. Um, and then if the system isn't built to respond to those, then things happen like people leave. So,
Right. No, totally. And you need to understand people's motivations. It's embarrassing now. I'll date myself again, but we used to have pagers, like a real pager, the
I
little black
remember
thing that
them.
beeps,
Yeah.
you push a button. And so when I first, started practicing, I'd have a pager, and I remember it's so weird to me now to even think about it. I actually didn't think about this till you brought this up. But I remember I would carry this pager. I got like an ego boost out of it. It was like a badge of honor, like here I am, like I'm the real deal. I've got this pager and people need me, and the ER is calling me and the ICU is calling me, and I felt good. And I felt that my efforts are paying off. Now, I mean, thankfully we don't use pagers too much anymore, but if you showed me a pager, I'd be like a vampire with holy water. It would, I would melt. So I feel very differently today than I did then. So my needs for, what I wanted to do and for ego gratification and everything else were totally different 15 years ago than they are today. If you could harness that energy, you could do so much more, like you say with the chair.
Yeah, exactly. if we had systems that responded to people, and your progression is completely normal, right? I mean, that is what it's like to grow up in the world, is that you have more people depending on you. You have perhaps family or parents or children or pets or something. You take on more and more responsibilities, and so this is to be expected. And if we know it's to be expected, then why don't we change the jobs along with it, right? So it's very odd to me that it's this is the job, and now we're going to try to fit these people who are all so different into this job, right? So okay, so we've got a few minutes left, and I was wondering, do you have any other resources or guidance that you'd like to share, or place that people can go for more information about the Physician Wellness Project?
Yeah, of course. So I love talking to people. So if you're a physician watching this and you want to learn how to improve your career or even change careers, I offer one-on-one consultations. If you're a hospital or medical group looking to attract or retain physicians, or you want to kind of change your practices, I'm always happy to consult with you. The best way to reach me is, well, LinkedIn. I'm very good with LinkedIn. I love using that. Gregory Charlop, Charlop. You can go to my website, which is www.gregorysharlopmd.com. And I'm always happy to chat with people. I'm on Facebook. I'm on Threads. I mean, I don't use those as much, but I'm there. If you Google me, you'll find me. And happy to help you. I think sometimes it helps to have someone kind of who's experienced things sort of say, look, this works, this doesn't work, and let's sort out how we could deploy it for you.
Would you describe yourself as a coach for physicians who are looking to make a change? Is that how it works, or how would you describe it?
I think so. It's funny. I'll tell you an embarrassing thing. So years ago, when I used to work a lot more, but I wasn't happy, but I couldn't quite figure out why.
Mm.
And I read this book, The 4 Hour Work Week, which if you haven't read, I highly recommend. And it's weird to say, but it's really weird to say, I guess, but this book almost gave me permission to do things differently. It almost made the book almost said, look, like you were talking about the 40-hour work week, right? The book almost said, look, you don't have to do it this way just because everybody else is doing it this way. When I was a doctor working a lot at the hospital, everybody I was hanging out with did the same thing, right? And we all did that when we were training. So we did that in medical school, we did it in residency, we did it in fellowship, and now all my peers are doing it. So in my mind, this is what everybody does. It's just what you do. It's how it is. I didn't really stop to think that there were other ways that you could live or work because I was so indoctrinated in this culture.
Mhm.
Reading this book, which wasn't even a book about medicine, it was the first thing that gave me permission to say, well, you really can do things differently. I mean, as odd as it is to say, I just never really even thought about that. So I guess if you ask me what I would look at myself as, I'm almost someone who will give you permission to do things differently and to say, well, these are some options. Why don't you look at it? And it's okay to do these things.
Oh, I love it. I think the cultures of work and the cultures of the professions are part of the reason these systems haven't evolved, because there's so much built up to, this is what it is to be a physician, right? This is what it is to be a nurse. This is what it is to be an engineer. And, that's it. And the truth is, we've made it all up. All of it is made up. So if we want to do something different, then we have to just make up different systems and do it differently, right? It isn't, I mean, it's a lot of unwinding, but it isn't rocket science. It's like, well, what should this look like? So I love that you help people envision what that could look like for themselves and for these systems, because I think everybody needs help envisioning what would a health promoting healthcare system look like for its own people, right?
Right. And the truth is, I see this in medicine, but I'm pretty sure this is happening in many other fields. You're getting hit with the brain drain, both on the young side and on the older side.
Mm.
The young side is thinking, well, why should I even bother putting up with this? I'm just going to do something else because there's all these other options. And the older side is feeling burnt out and ready to quit. And so you're losing kind of people left and right. And I think though it doesn't have to be that way. You could show the younger people, yeah, this is a great profession, and you're
Mhm.
not just boxed into a corner, and there's a lot of advantages to it. And you could show the older people, yes, you could still practice medicine or nursing or whatever, and you are valued, but still do other things and not get burned out from it. So I think there are solutions to it both ways, but if things are left as they are, we're going to face a serious staffing shortage. And as you said, the high turnover, which is not good for anybody. And you know what?
No,
We're all going to be patients one day too. When I have to go to the ER with my heart attack or whatever, I want someone to be there to take care of me.
absolutely. And in some of the specialties, I think we already are at that crisis point. And I think you bringing up emergency medicine is well taken. Um, so, Dr. Charlop, I'm so happy to have spent this time with you. We'll put the information that you spoke underneath this video so people can find you. And thank you again for taking the time to talk with me.
No, thank you for having me on. It was a lot of fun.
Well, take good care.
Great.